السلام عليكم ورحمة الله وبركاته. أنا الدكتور أحمد فول، رئيس وحدة طب المسنين مستشفى راشد هيئة صحة دبي. Today I'm going to talk about incontinence in urine, incontinence of urine in elderly women. The topic of incontinence is very important, very critical, and very embarrassing to ladies. Because most of the ladies hide this problem and keep it for herself. She feels embarrassed when she sits on a chair in the hall and the chair become wet after she came out, she stand up. If she ride a car, she probably leave the car chair wet with urine. So it's embarrassing problem. And this problem prevents the lady from leaving the house, probably prevent her from leaving her room. And some ladies use pampers to hide this problem. But the smell of the lady appears when she visits the physician in the clinic. And physician has to ask all elderly ladies above the age of menopause about this problem. And intelligent physicians usually ask these patients alone. So if the patient come with her daughter or her son or her relative or friend, it's better for the physician to ask her for a confidential questions. For the problems of incontinence, it's not only the problem of smell and isolation. Some patients who cannot hold their water for time till they reach the toilet and they go fast, they may fall down and they get fractures. This is the most serious implications of the problem. And we know that hip fracture causes mortality in 25% of patients in the first year. It's a serious issue. Now I need to discuss two topics or two types of incontinence. The first one is urgency incontinence and the second one is stress incontinence. The urgency incontinence, as I said before, when the patient feels that she needs to go to the toilet, she feels it like urge that if I did not reach now, big amount of urine will pass from me. And this happens. That's why the lady should go fast to the toilet. And if she did not reach in time, urine will escape in large amount. The other type is the stress incontinence. And the stress incontinence, as I will describe now, is due to sudden increase in the intra-abdominal pressure. When somebody cough, sneeze, or carry something heavy from the floor, like carrying a child, sudden increase in the intra-abdominal pressure will lead to escape of few drops of urine. And this is also embarrassing, but it's not big like the first one. Some ladies have both of the problems together. So in order to treat them, you have to know which one is the main problem. There are other types of incontinence. I need here to mention the overflow incontinence, which we find in people with spinal cord injuries that affect the urinary bladder center in the spinal cord. Here the bladder wall becomes atonic. Probably it does not sense it does not feel the urine inside. So the urinary bladder collects urine till the pressure inside the urinary bladders exceed the closing pressure of the urethra. Then the urethra opens and urine escape. Urine escape till the pressure inside the urinary bladder equals the urethral closure pressure. Then the bladder will close and still there is urine inside the bladder. Then urine is coming out from the kidneys, up to fill again the bladder. When the pressure exceeds the pressure of the urethra, it will open and urine will escape. Till pressure equals the pressure of the urethra, it will close again. So this patient is always wet. Any drop coming from up will escape from down. These patients usually are bedridden. They are young. in age, and the solution with this patient is to put urinary catheter, self-catheterization. The patient himself put the catheter for himself and remove it for herself, usually if they are ladies. So the most important two types are the stress incontinence, the urgency incontinence. What are the solutions? The solution is, first thing, you have to tell your physician about your problem, and if you have somebody, tell the physicians that I need to tell you about something confidential, and the physician should have a confidential talk with the patient about this problem. All ladies above the age of menopause. What is the other thing? There are two methods to train the bladder to tolerate the amount of urine. The first one, if the lady knows that she has to go to the toilet every 1 hour, so she has to train the bladder to tolerate the urine for 1 hour and 5 minutes more. So when you feel urge to urination, you can breathe like that, slowly, for 5 minutes, or count 1, 2, 3, 4, 5, or go slowly. Instead of going fast to the toilet, try to hold and go slowly to the toilet, training the bladder to keep the urine as much as you can tolerate. Day by day, the bladder can accommodate larger amount of urine for longer time. This is one method. The second method is Kegel exercise. Kegel exercise is a training of the pelvic floor muscles. What is the pelvic floor muscles? Pelvic floor muscles, as this diagram shows, this is the urinary bladder and this is the urethra. And there should be an angle between the urethra and the urinary bladder. This angle is kept stable by the pelvic floor muscles, which are these. If these pelvic floor muscles are weak, this urethra will move to be in a straight line with the urinary bladder, so that any pressure inside will lead the urine to escape immediately. So I need to preserve this angle again, or to keep this urethra in a fixed position instead of moving forward and backwards. The Kegel exercise is training to this muscle which is inside the pelvis, inside the abdomen, from deeply inside the abdomen or the pelvis. How will train this muscle? Simply, if you are in an elevator with people around you in the elevator and you need to pass some air, what you will do? You will do a movement to prevent escape of the air. This movement is the exercise. So the exercise, imagine that you need to pass water, urinate, or you pass air, or you pass a stool, or feces while you are in elevator. You need to hold to prevent this happening. This hold movement is the exercise. Some people, while they are doing this exercise, they also exercise their abdominal muscles, like you find them, this is not the one that I need. I need you to exercise only the muscles inside, which holds, prevents you from passing air or feces or urine. Don't move your leg muscles, don't move your thigh muscles. Only put your hand on your thigh and see if it is moving also while you are doing the exercise. If it is moving, you are not doing the exercise correct, because you are distributing your effort between the pelvic floor muscles and the thigh muscles. I need you to concentrate only on the pelvic floor muscles. If you're contracting your abdominal muscles while you are doing this exercise, you are not concentrating on the pelvic floor muscles. This exercise can be done 5 seconds with rest 5 seconds, 5 seconds, rest 5 seconds. And then you repeat 3 times per day, in the morning, in the night before sleep, and in the afternoon. And the more you do, the more better the results. Now, this is the general treatment of all incontinence. But for urgency incontinence, people who find it urgent to go to the toilet, otherwise they will pass water, there is treatment, there is medicine for them to inhibit the bladder. It's available, it's cheap, and anybody can use it. with very little side effects. The side effects is probably dryness of the mouth, dryness of the tears, but there are medicine which has little side effect, more specific, act only on the wall of the urinary bladder. That's why it does not cause these side effects. Anyway, the treatment is available and it's effective. The treatment for stress incontinence is conservative treatment. Sometimes when the problem is not big, there is what we call bezary or ring. It's like a silicone made ring. The lady put it inside the vagina by the help of the gynecologist, who will select the size suitable for the lady and put it first time to show the lady how it's put. After that, the lady can put it herself. It can be removed each night and cleaned and put again. This bezary will help to preserve the angle between the urethra and the urinary bladder. Instead of this urethra moving freely, it will preserve, when I put this ring, it will preserve the angle between the urethra and the urinary bladder. That's why it will help the lady to control on her urine or her water while coughing or sneezing. Thank you so much for listening.